One of the most common conditions that we see with MUA are related to the cervical spine or the neck. The cervical spine actually isn't just the cervical spine by itself. It's connected through muscles from the neck into the shoulder blade, and then down into the arm. And so what happens is very often these conditions come together. When you have a problem that starts in the neck, it automatically goes into the shoulder and the spine. Often we see frozen shoulders that are really related to the cervical spine, but the muscles that connect between the two have developed contracture in them, fibrous adhesions, and then what happens is once the person begins to guard and has pain, now all of the muscles begin to have what we call disuse atrophy. It's like a vicious cycle, and the muscles begin to become shorter, thicker, more fibrous until everything is frozen. People find they can no longer lift their arm, think it's a shoulder problem, and it's actually a problem that's in the neck. And so what happens as a result of the muscles going from the neck all the way into the shoulder, when we apply the manipulative techniques in manipulation under anesthesia, we can begin to open up the connection between those two areas. So we begin to stretch out the muscles from the neck into the shoulder. Once we've brought through different ranges of motion, we then use our hands to deal with all the trigger points on the various muscle tissue levels. All of this could not be done if the person was awake. And so we put them under a light sedation so they don't feel any pain at all. Now that we have worked on the deep muscles and the superficial muscles by stretching and deep tissue massage, now we can begin to apply manipulative techniques directly into the joints that are now no longer being tied up by the muscles that are tight. So it's really a three-level procedure. We're dealing with the superficial level muscles, then we get into the deep level muscles, and then we're able to get right into the joints and use our quick manipulative techniques to reform the scar tissue, to break it down and then have it reform in a better fashion. So we have people who can't lift their shoulders, and by the time we're done, they've got their hands over their heads, and it was actually related to their cervical spine. Now, this can also stem from when a person has had, say, a car accident. They've gone through a whiplash injury, and that has injured some discs in the neck, and that sets a sequelae going along that if there is incomplete healing, the muscles around the disc and around those joints begin to tighten up in response to protect the area. There's lack of blood supply, scar tissue comes in, and as that develops further, it then gets into the superficial muscles and then the long muscles that go through the different areas. So we have to address both areas, the shoulder and the neck, in order to get the patient better. These disc injuries, which usually start as the initial cause of the problem, often months and years down the line are actually no longer the problem. It's the disuse atrophy and the muscles that went into spasm to support the injury that is now causing the person's pain. And so if we go in there and just work on the disc, the person has an incomplete healing. And that's the strength of MUA, because by doing the procedures from the joints to the superficial and deep muscles, we can remove the pressure from that disc, restoring a more proper alignment of the vertebrae and mechanics of the spine, and so the disc no longer inflames. Despite the fact that it's still there, the person goes on to have normal function in life, do all the things that they love to do, whether it's sporting or it's cleaning their house or whatever it might be. They get to do those things normally again, despite the fact that there's still a bulging or herniated disc.